2010 brought the most significant changes to our nation's healthcare system since the establishment of Medicare and Medicaid in the 1960s. The Affordable Care Act, an overhaul of insurance coverage, expansion of Medicaid, and establishment of insurance exchanges were among the many provisions of the law that DCHA worked to navigate with its members and district leaders.
First and foremost, I think the city needs to really be acknowledged and applauded for their leadership for thinking ahead prior to the Affordable Care Act and setting up a system of care that actually expanded coverage and up to about 97%, the third in the nation. And so I think what that did is actually put the hospitals more of a readiness position compared to other jurisdictions, but also gave them more flexibility to actually look at not only getting funding, but how we might be able to look at ways to actually think about ways to be engaged in activities beyond the four walls and not just focus on coverage, but now being able to move to focusing on health outcomes and better qualities.
Affordable Care Act included a lot of other provisions in addition to just expanding coverage, provisions that began to move us toward coordinated care mechanisms that really put an emphasis on clinically integrated care, whether it's through bundling arrangements or accountable care organizations. So we think it's a great framework. It's a great framework that we continue to build on, and we continue to support it.
Tragedy struck again on September 16, 2013. A gunman opened fire at the Washington Navy Yard. There were 12 deaths and multiple injuries. DC hospitals were called upon to respond. Trauma centers in the district treated the victims, and the emergency preparedness procedures established by DCHA members ensured a swift, coordinated medical response. As DCHA's fourth decade of service began, the nation was mired in a deep recession that impacted all sectors of the economy. Budget cuts were everywhere, but DCHA aggressively lobbied to minimize the impact of cuts affecting health care in the district.
The Health and Human Services component of the district budget is the largest piece of the budget that there is, and so it obviously gets a lot of attention when there are times of stress. We were able to, as a community and as an association, come together and help the council members and help the mayor understand the critical importance of not only the safety net hospitals in the district, but the importance of a healthy healthcare community to the district in terms of attracting new residents, in terms of the tax base, in terms of all the things that we do for the community beyond providing those critical healthcare services. And I think that that was an effective strategy for us.
A regulatory effort to shift staffing decisions from medical care teams to predetermined and arbitrary ratios was successfully opposed.
And DCHA was able to bring us together and to create a solid voice against this bill and testified against the bill, and ultimately that bill was defeated.
Throughout this decade, our members achieved many milestones, including top rankings, medical advances, new partnerships, expansion of services, and treatment of emerging disease threats. 40 years after its founding, DCHA remains a 14-member association. Thanks to advances in care and increased service efficiencies, DC hospitals can now satisfy residents' needs with 2,800 beds. Employee count remains stable. Combined operating expenses have grown to $5.8 billion, and the uninsured now receive $90 million in care. For 4 decades, DCHA has worked to be the voice of DC hospitals and a champion for district residents, ensuring they thrive and are given the world-class health care they deserve.